baseline surviving this pandemic is hard. Then you add mental health issues on top. Then you add financial strain on top. Then you add the increased risk of suicide, and you don't have enough support. I don't think that's fair for one of the top nations in the world.
According to the Commonwealth Fund, 45% of American adults who reported experiencing emotional distress also reported being concerned of social and economic needs, compared to only 16 to 19% of adults reporting the same concern in England, France, and Germany.
When we look at other countries, Austria, for example, they went through difficult financial strain. However, they had very strong labor laws and very generous welfare programs in place. So even through their terrifying recessions that they went through, they were able to see a slight decrease in suicide rates. For the US, we have in the last 10 years, so 1999 to 2018, we've had a 35% increase in death by suicide. When you think about anything, if I said there was a 35% increase in death by diabetes, there would be an outcry. There would be an issue of why don't we have healthcare? Why don't we have nurses checking on these people? We should dispense glucometers. But because it's mental health and it carries the stigma, there isn't that public outcry. There is shame and there is stigma that limits the support that people have. And that's, again, an issue. And these are national issues. This is a public health crisis.
Data from the Economic Policy Institute show how COVID-19 has had a disproportionate effect on unemployment rates among younger workers, who predominantly work in leisure and hospitality, where unemployment declined by 41% between February and May 2020.
One of the biggest hit age groups at baseline for us, suicide, the second leading cause of death in 10 to 35 age group. So that's kind of our youth, our future, our optimism almost. And then you also think about unemployment rates are generally higher in that age group. They're also the ones sitting at home now without their friends, without building that social connection, zooming away. And how do you build resiliency in that age group and connection and continue to kind of be motivated to be part of the world? Because the other thing that's happening is that, at least what I'm seeing constantly, is that sense of overwhelming fatigue, of exhaustion by the world. Election or fires or environment, it's eating away at people and it feels too big and too much, and I can't do anything. And when you feel helpless and unempowered, that also takes away from your sense of agency. I personally get on a soapbox when it comes to parenting and mental illness in terms of how are you parenting and what are you building in a child? Because resiliency is hard to build. Failure tolerance is hard to build. Frustration tolerance, distress tolerance, those are essential skills, right? The 9 times table is also very important. However, these are also crucial skills. And at times we don't have them ourselves to kind of teach our children and work them through those things. So when you look at historic issues, resilience tends to break like 3 months later. So you see people that are moved by war or hurricanes or floods. Initially, they're okay. They're in this fight or flight mode. And by 3 months later, they're like, okay, I can't do this. Now there's the stress disorders and the PTSD that shows up. And we've kind of passed that as well. And now we're in adaptation and change. And how do we survive this? And so for those people that have that resiliency and have that agency to be like, let me rebuild my life and get to this new normal, it works. And then there's people that are like, reject this new normal, and that's hard. And those that don't have a choice, and they don't have a choice to reject or approve, they just gotta live. So essential workers or those that are providing healthcare, their rates of depression have gone up, and that was the CDC study in June. And so thinking about whether you had to go in and feeling like you're an essential worker or healthcare providers or people who are taking care of adults at home, but you have to, because what else are you going to do? There's not any jobs out there.
A new study from Cornell University showed that a significant number of Americans who returned to work in May through July are being laid off again as government payroll protection program funds run out.
Unstable employment or not having a perceived sense of comfort in there, like I could lose my job any day, is also a big factor when it comes to strain and your mental health getting affected. And because, yes, we have people that have been employed again, you're back in your probationary periods. You're not sure if I don't know what's going to happen. Is Arizona going to close again? And am I going to have a job? And that is also, so you may be employed, but that sense of uncertainty doesn't help. And so that also is another consideration. So if you're seeing this and you're thinking about family members and you're like, they just got their job back, still worth maybe a check-in. This is the busiest my clinic has ever been. We have never had this level of demand. I have friends in internal medicine and pulmonary critical care that were running the COVID units, and they were putting in extra work and running overtime, and schools are closed, and these are women I know who have kids at home, and it's exhausting. It takes from you, and it's not sustainable. And I think there is a humanity to medicine and there is a business side of medicine, and it's kind of shifted about where we care about. Do we care about the humanity or do we care about the business?
The Commonwealth Fund reports that more than 112 million Americans live in areas where mental health care is in short supply, with experts predicting increasing shortages in mental health professionals through 2025. Their data shows the urgent need for improvement in policies to expand coverage of telemental health that should be rigorously studied and potentially made permanent as a strategy to increase access to mental health services.
If you're worried about someone, ask them. There's always that question of what's the stigma and all that jazz, and don't worry about it. You're not going to make somebody think of suicide. They've already thought about it. So ask them, and if you're help them with basic things. Making an appointment is hard. Looking up a therapist and figuring out who's covered in your insurance is hard. And if you're worried about a loved one, do those things for them. Help them through that piece. Figure out your social bubble. You can't hang out with everybody, and that's fine. Who can you? Who is your bubble that you're going to interact with and you're going to be safe with together? Because you can't completely be isolated either. And so how are you going to navigate that connection for yourself and for your friends? Sleep, eat. Strength training has some data associated with it. Things that you can do that will change your life, because I think that's the other piece is this is constant change and constant transition, and there's a fatigue to that. So how do you take ownership of some of that change? Small ownership that you can take, small things that you can control, and kind of build on that.